As you know, the atrial fibrillation is the increasing phenomena because of the aging population of the world, and it's the most common arrhythmia in all of the world, especially in the Europe and North America, and also in my country, Iran. According to the last guideline, which published by EHRA in 2023, the most interventions like PV isolation, cryoballoon ablation, and other interventions are better management for the atrial fibrillation than drug therapy. In this video, I try to show you a type of ablation named VOM, ablation of the vein of Marshall, which are done in Shiraz in Payvand Hospital, Bu Ali Sina Payvand Hospital in Sadra town. Me and my dear colleague, Professor Abdi, an interventionist, an excellent interventionist in Shiraz, famous excellent interventionist in Shiraz, try to do the ablation in this video and show how in Shiraz we do the VOM ablation in our cases. Our colleagues in this video are Mrs. Bordbar, our anesthesiologist, and also Mr. Wahid Rezai, Mrs. Jafari, and Abdurreza Dehanian, which are our team in doing this video. We use the access from the subclavian vein and also from the femoral vein. We start with the cannulation of the CS. We advance long sheet to the CS from the subclavian vein. We do a venography to find the vein of Marshall. For better finding the vein of Marshall and better delineation of its origin, we use occlusive venography. The device mostly used in implanting CRT devices, and we use it for advance it through the long sheet to the CS, and then 2 cc air was injected and the balloon inflated, and then the venography was done to find the vein of Marshall. As you know, the vein of Marshall origin is in the first third of the coronary sinus and in the middle part, in the medial side, I mean. نه دیگه پیدا شد. بعد بچه‌ها چیزش میکنید آخریه رو رن میکنید. آره این چیز هست. دکتر هستش. We also have RAO projection. In our view, the RAO projection showed better the vein of Marshall, and the cannulation is easier for our interventionist, Dr. Abdi. So as you see in this projection, the RAO vein of Marshall seen clearly. آره بزرگی نیست ولی برای کی هم نیست. خب حالا ما اینو یه ذره بریم بالاتر، اینو میاد. خب دیگه از اینجا بعدش رو بید. As I tried to see here, the cannulation is not so easy as you may have some trial and error to cannulate the vein of Marshall. Uh, as you see in this video, our first attempt failed. It's also important to have a sizable vein of Marshall. Sometimes the vein of Marshall is very small and the cannulation is very difficult. And also you should advance a balloon over the wire to this vein. This should and be a sizable vein of Marshall as our cases, but sometimes there's not this size of vein of Marshall. Our interventionists, like most interventionists, are more familiar to do the cannulation and angioplasty from the femoral vein. So we change the position and try to cannulate the vein of Marshall from the femoral axis. And as you see, we succeed and can cannulate the vein here. Here we try to show that the 0.014 guide wire is is entered to the vein of Marshall. In the IO projection, it's clear that after contrast injection that we are deeply cannulated the vein of Marshall, and the scene is ready for a balloon to go over the wire to the target, and then we start the injection of alcohol. After cannulation of the vein of Marshall by the 0.14 guide wire. We advance a balloon over the wire to the vein of Marshall, and the vein of Marshall should be sizable, and the size of the balloon is also depend on the size of vein. According to the sizable vein tank that we have here, we inject 3 cc of alcohol to it from distal mid part and proximal part. After that, we should be aware and be totally certain that we totally banished the vein of Marshall. So the necrosis occurred in the parasympathetic plexus that are here near the vein of Marshall. Here you can see the step-by-step alcohol injection to the vein of Marshall. We wait between injections 1 or 2 minutes. We're waiting to the vein to form clots and vanish totally. And then came out and tried to inject some dye and be totally certain that the vein of Marshall has been vanished for this patient, and the ganglionic plexus and also some area that are had some blood supply to that is totally necrotic.
سلام شده نگه